All right, thank you for staying with the Monday Report. Let's continue the comprehensive coverage of Ruto in 1 year, from addressing the crisis of shortage of healthcare workers to reducing the cost and improving access to healthcare. These were among the major promises that decorated President William Ruto's manifesto. He came into office pledging a raft of measures under the Kenya Kwanza government, seeking to fix what was ailing the health sector. Tonight on our special report, Ruto in 1 year, Serfine Achieng Ouma is on the healthcare watch.
We will have a universal health insurance that will make sure that every Kenyan will go to hospital and they will walk away without paying a penny.
On the campaign trail, William Ruto, then Deputy President and the Kenya Kwanza presidential candidate, made a firm pledge to fix the ailing Kenya's health sector.
Private hospitals, we're going to bring public hospitals, we are going to bring other players, and we purchase drugs for Kenya collectively.
And upon being sworn in, President Ruto unveiled the plan that included a promise to employ 20,000 healthcare workers within his first 100 days. It's more than a year since Ruto made this promise, but according to Peterson Wachira, who chairs Kenya's Union of Clinical Officers, it remains just that, a promise.
We were expecting that we would see this in the first 100 days. That never happened. So I would call that a miss.
During President Ruto's first year, long-standing grievances have seen healthcare workers staging strikes to protest delayed salaries nearly every month.
There are many strikes. I know some counties, like Nandi, is about to go on strike. Makueni is also threatening to go on strike. There are several counties that are threatening to go on strikes because of things that have not actually been able to move.
The establishment of a Health Service Commission still remains another unfulfilled Kenya Kwanza campaign promise.
Most of the strikes that we have had, which are more than 150 in the past 1 decade under the counties, is because of ineffective management of human resources. Be it they are not being promoted on time, they are not being paid on time, they are being employed on some terms that are irregular and discriminatory and exploitative. And so he has not said that he's not probably constituting it. It has taken probably a long time to do that. We still hope he does it, but it falls on his door.
In order to ease the pressure on hospitals and the burden on healthcare workers, President Ruto had said that the government would invest heavily on preventive care as opposed to curative care.
Many critical health illnesses, including cancer, heart complications, kidney failure, and hypertension, can be detected and addressed at this level without the need for hospital visit or admission.
The work of health promoters is health promotion. And in health promotion, they are going out there to inform people about the disease, how to prevent it, how to know when you have it, and what to do and where to go when you have the disease. So basically, in summary, they are going to improve the health-seeking behavior. So in the short term, you are going to see people flocking into the hospitals. Then they are going to find a hospital where you have a shortage of health workers.
In the year that was, the government also invested on the universal healthcare, seeking to further cut the cost of health services.
Kenyan families spend a total of 150 billion in out-of-pocket expenditure on health services a year, mobilized from various sources including Harambes, WhatsApp and M-Pesa groups, loans, sale of land and other assets to pay hospital bills for loved ones.
To accelerate movement towards universal healthcare, President Ruto's administration has been keen on implementing key health system reforms. The giant Kenya Medical Supplies Authority has, however, been something of a blot on the fabric as scandals and talk of cartels dominate KEMSA's news supplies.
I want to give you my commitment. I will clean up KEMSA, whatever it takes, Mr. President, whatever it costs.
A 3.5 billion shillings tender for the supply of treated mosquito nets threw KEMSA on the scandal's path during the year. Global Fund cancelled KEMSA's procurement process, which appeared to favour a bidder who did not meet the mandatory requirements. KEMSA former CEO Terry Ramadhani and the entire board was forced out of office as a result of the scandal.
They say a new broom sweeps clean, and I really hope that as a new broom I should be able to sweep clean this ministry.
To further enhance access to medical services, 4 crucial bills which will guide the process of implementing the universal health coverage have been approved by Cabinet. The bills include Social Health Insurance Bill, Primary Healthcare Bill, Digital Health Bill, and the Facility Health Improvement Financing Bill. But even before the bills get a nod in Parliament and signed into law by President William Ruto, there has been an uproar from the Council of Governors who are accusing the Ministry of Health of sidelining them in the preparation of the 4 crucial bills.
Your legal team and our legal team, which have not sat anywhere, should have sat and agreed on these issues before they go out to the stakeholders, unless we are being treated as stakeholders.
Under the proposed reforms, NHIF will be restructured and a new National Social Health Fund established. To finance the plan, formal employees will, if the bill gets a nod from Parliament, contribute 2.75% of their monthly earnings. This President Ruto terming as a move to spur the uptake of NHIF and equalize contribution.
Haiwezekani kwamba mimi rais nalipa shilingi 1,700 kila mwezi, na mama mboga na mtu ya bodaboda analipa shilingi 500 ili akuwe na kadi ya NHIF. Mimi mshahara yangu ni 1,000,000. Yule bodaboda mapato yake ni 5,000. Kuna ungwana pale kweli?
This means that a worker earning a gross salary of 50,000 shillings would remit 1,350 shillings per month. Those earning 100,000 shillings will pay 2,700 shillings per month, while those earning 300,000 will pay as high as 8,100 shillings per month. Even with the reduction of contribution for low-income earners from 500 to 300 shillings per month, the move by the government didn't fail to attract mixed reactions from Kenyans, with some terming it punitive.
Kwangu kwanza itanifinya kukata hiyo 2.7, lakini on the other side itasaidia yule mfanyakazi wa chini. Lakini kitu ambacho nataka niambie rais, tunaendanga hospitalini wanakuambia pima hapo kitu, na ndio tunatoa cash, na ile hali unakatwa NHIF.
Kulingana kadri ya uwezo wa fedha ninazo, naweza simamia mtu mmoja. Juu hatuwezi ongoja ugonjwa izidi mpaka ndio utibiwe.
As a new chapter begins going into the second year, Kenyans remain optimistic that it is time to move beyond the diagnosis, hoping that President William Ruto's administration will fast-track the implementation of the treatment plan, setting the health sector on its path to full recovery. Serfine Achieng Ouma, Citizen TV, Nairobi.